Good afternoon, ladies and gentlemen, all of our community partners. We're so excited today to welcome you to the 59th week of the Flint Community Webinar on Coronavirus, sponsored by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the new partner now, the Prevention Research Center of Michigan. I'm your moderator today, Yvonne Lewis, and I was kind of sitting on the edge of my seat listening to the music, which created this excitement about what's going to be shared with us today. So we thank you for joining us. And during this 59 weeks, as you can see, and hopefully have heard us talk about the wonderful partners that have helped us to make sure that during these weeks, we've been able to provide for you information, education, resources, and services to help us really understand how to move through this global pandemic based upon what's available to us in our community. So we thank you for joining us. And we want you to know right now that you can like us on any of our social media platforms. Join us if you're listening. Have some of our friends join us on Facebook Live today. We have a great webinar for you today. We're going to hear about Johnson & Johnson vaccines. There's been a lot of conversation about that. I'm reminded of what Dr. Reynolds has told us over and over again, and some of our other partners. Things change almost every other day, or at least twice a week. We're getting some changes. So we want to bring you up to date on that. Vaccine safety, vaccine administration here in Genesee County, how to get shots in the arm, and National Mental Health Awareness Month is coming up in May. So we welcome you to join us, and if you have questions, please feel free to put them in the Q&A, and we'll be paying attention to answer those questions for you. Want to remind you today is April 30th. It is actually the last day of Minority Health Awareness Week, National Minority Health Awareness Month, excuse me. And the focus has been vaccine ready. We know we have spent over a year now with the COVID situation, as you can see, 59 weeks. We spent over a year talking about this. And one of the things I was mindful of as I was thinking about National Minority Awareness Month is looking at the differences in health outcomes. And I paid attention. There are three major health conditions or health issues: heart disease, cancer, and stroke, that are the three leading causes of death. But when we look specifically at the African-American community, African-Americans are more likely to die from heart disease, cancer, stroke, homicide, unintentional injury, diabetes, hypertension, and hypertensive renal disease, and HIV than any other of our counterparts in the county, not just the state of Michigan, not just the United States, but the state of Michigan. So one of the focuses for National Minority Health Awareness Week, though we know it's ending today, is to encourage you, listen to what you're going to hear coming up in this roundtable that we're going to have in the next few moments, and pay attention to how you, particularly as individuals, but we as a collective community, can press in on creating the equity necessary to reduce the disparities in these health outcomes. I'd like to invite our panelists to join me now in our roundtable. We're going to talk about these major issues that we talked about today, this Johnson & Johnson vaccine safety, but I also want to talk about, to you, Dr. Reynolds. I want to start with you, Dr. Reynolds, as serving in multiple roles, and I hope you can put your hat on right now as a chief advisor for the city of Flint, health advisor for the city of Flint, and you've got some really important tidbits you want to share with our listeners for today.
All right. Well, first of all, good morning, everybody, and I hope everyone is well and in their households also. We have had some exciting developments, and some will be covered later, but what I would like to emphasize is this: get vaccinated. Get vaccinated as soon as possible. Get whatever vaccine you can get as soon as possible. Because we have variants that are coming throughout the United States. And, you know, like I've said before, they may name it after Brazil, South Africa, California, but we can get our own variants here that will create problems for us if we are not vaccinated. So it is critical that everybody who can do so. And as my colleague, Dr. Verholden, said around voter registration time, and you can register to vote too, but make a plan so you can get your children 16 through 18 to the vaccination site. Make sure you can get your loved ones to the vaccination site. They're not available for children under 16 yet, but we must protect them by getting vaccinated also. And so there's a lot of talk about, well, who can wear a mask and who doesn't need to wear a mask.
Mhm.
My advice to everybody is keep a couple of masks in your pocket, one for you and one for somebody else. The usual advice is when you walk into a situation, especially indoor, and it's too crowded and the ventilation is poor, back up. It's still not a good situation for anybody. And then if you're hanging with people that you really don't know their vaccination status, or you're not sure they're going to give you a truthful response, put that mask on and actually offer them a mask too. And if it's your house, you can tell them, don't come in. If it's your car, you can tell them, well, I'm going to have to roll down the windows after you put on your mask, because indoor situations are the biggest problem right now, indoor and poorly ventilated. And remember, as we progress and we hit those goals of 55%, 60%, 70% having received their first vaccine, we still have to wait 2 weeks before we can move on to the next level. So if you read in the paper, everything's fine, we hit 55%, we have to wait for the word 2 weeks later before we loosen things up. And the other thing that people may overlook in their reading is if the case rate goes up in a region, the governor and the health departments will have to slow down the mask, the easing up on the mask restrictions and other social gatherings and activities. So it's incumbent on us. If you're not vaccinated, wear the mask. If you are, keep a couple in your pocket. Avoid crowded, poorly ventilated places. And if you don't feel well, get tested. If you don't feel well and you know you have some other conditions, see your provider, see your doctor. And if you don't know where to go, you can call Hamilton, you can call Genesee Health Systems, you can call Genesee Health Plan. And it's not the deadline for applying for insurance either. So if you don't have insurance, call Genesee Health Plan and talk to them. Thank you.
Thank you, Dr. Reynolds. A lot of resources and the words of wisdom from our Chief Health Advisor to set the stage, because you said these are things that we must do, pay attention to. I'm going to ask Dr. Deborah Holden, Dr. Jennifer Edwards Johnson, and Dr. Wolford to join us in this conversation now, because there's been some questions. We've had this change from the Johnson & Johnson vaccine. It was available, then it wasn't available. There were some concerns. Help us as a community understand, because Dr. Reynolds, you said, get the vaccine, but yet there are questions. So Dr. Holden, I know you love the conversation about these case rates and helping us understand that. And Dr. Jennifer, you definitely are in the hospitals doing rounds, and our pediatrician again, Dr. Wolford. So I'm going to just step back now and say, you ladies and Dr. Reynolds, tell us what we need to know here.
So I want to acknowledge Dr. EJ too, because she's in the hospital. She was rounding right before she came here, and it's pretty cool. Dr. EJ and I do a lot of live talks together, and I just really appreciate. Dr. Reynolds said, you got to be prepared for things to change about twice a week with COVID. And this is true. So I want to make sure people are clear. There's no magic crystal ball. Dr. EJ, Dr. Wolford, myself, and others, we're doing a lot of real-time research, right? They've got what they're seeing in the clinic. And I really think it's important that we hear about what they're seeing in the clinic, but we're also doing a lot of research in the background to try to bring people the latest and greatest information. The one thing that I will say is, and I remind people, we flattened the curve earlier in the pandemic in the absence of a vaccine. We did that with good old-fashioned prevention and public health. The vaccine was supposed to be the game changer. It was supposed to be the thing that ultimately really tipped the scales in our favor for us to get this pandemic under control. The mistake that I think we've made is all of those great prevention measures, wearing your mask, practicing physical distancing, practicing good hand hygiene, all of those governmental supports from enhanced unemployment, supporting people to be able to shelter in place and all of that. The goal with the vaccine is to keep all of those things in place and add the vaccine so we can turn the tides. So I just want to emphasize for people, because I've had a lot of people say, well, if I still got to wear a mask after I get vaccinated, what's the point? Here's the point. The point is to prevent you from getting sick. The point is to greatly reduce the likelihood that if you did get sick, you would be a severe case of COVID, to prevent you from and greatly reduce the risk of you spreading it to others, and to keep our community safe and well and healthy overall. 99% of hospitalized COVID cases are unvaccinated people. We've heard a little bit about these breakthrough cases. That happens with anything. There's no thing that I know of that's 100%. 95% is strong. That means about 5% of the times it might fail for people. But trust me, you would much rather contract COVID as a vaccinated person than an unvaccinated person. The outcomes are night and day different for people. So I'm gonna stop and hand it over to our great physicians who are actually out there on the front line seeing our families and our kids.
Dr. EJ.
Yeah, I would just second everything that Dr. Verholden said. Today our service has 30-year-old patients in the COVID unit, and these are largely unvaccinated populations. What we do know is that those who are getting vaccinated, if they do happen to get COVID, have far more mild side effects than those who contract it without being vaccinated. So I think highlighting all of our public health measures, washing your hands, distancing where you can, and getting vaccinated will definitely go far to keep us not only staying out of the hospital, but decreasing your risk for severe symptoms.
Yeah, and I think it's important that we remember that for children, at least those under 16 at the moment, there isn't the vaccine yet, but that might come soon. So until then, particularly for children, we have to also emphasize the need to do all of those prevention things, to wash hands, to wear masks, to stay social distance or physically distanced, and then consider getting the vaccine once it's available for them. And I think just as for us as adults, people just need to stay informed. I know it's hard, and that's why but one of the things we're hoping to do through this webinar is to help keep everyone in Flint informed of how things are changing, what new information we have, and so that you can use that as you make decisions about getting the vaccine and getting your child vaccinated. Many of us recall being no, I don't think I want that vaccine, and then learning more about it and becoming, yes, please put me not first in line, but next in line for the vaccine. And so just let's keep ourselves informed so that we'll be able to make that decision for our children as well.
Right.
Dr. Wolford, I was one of those people. I was a no initially. Actually, I was a hex no. I was a hex no, because I needed to know more and I needed to get more information. And I actually had a conversation with Leon McDougall, Dr. McDougall, who's the president of the National Medical Association. And I said, I haven't seen the FDA reports. I'm a data person. I want to see the results from the clinical trial. That should be, information that can be shared. He said, Deborah, it's on the FDA website. I said, what? So I went to the website and I checked it out. Because why? Because I'm trained in that work. So I can be a good, trusted messenger to help decipher and distill that down for people. And so I understand what it is for people to be grappling and have questions. But by all means, get those questions answered. I moved pretty quickly on the continuum because little did I know I would have an opportunity to take the vaccine. So it took me about 3 weeks. In about 3 weeks, I went from a hex no to I'll get in line. And I did, and I don't regret that. And literally, I've shared personally, my own daughter and my own household, 19, got COVID. At the time, her age group was not in the eligibility group. And in our own household, I did not contract COVID. I did not contract COVID, and neither did my son. And now we're all vaccinated, and we have a pregnant member in the family. So we got to put that hedge of protection around her. So I echo what Dr. Reynolds said. For those who can, you should.
So Dr. Deborah and Dr. EJ, Dr. Wolford, now you all are giving us some data and you're out there in the trenches, you do that study, but there are some who won't be able to go to the FDA. And if we go to that website, we may not understand. So I'm gonna ask you this, Johnson & Johnson, this is a specific question folks have right now. Johnson & Johnson was available to us. Then it was paused twice. So now we want to move on this continuum, but help us understand now. Johnson & Johnson paused twice, but people are still encouraged to get it. Help us to understand the distinction and why.
I think the most important thing to think about with Johnson & Johnson is to have a little bit of context, right? So when we first paused Johnson & Johnson, there were 6 or 7 cases in about 7 million people who had received the vaccine, right? A very, very, very small sort of occurrence of this side effect that we were worried about. And the side effect that we're talking about was a severe side effect, which is part of the reason we paused, right? There were clots that were really significant and scary for populations who experienced it. Part of the reason we paused is to understand, who is this happening to? Why is it happening? And what do we need to do if it happens, right? And it was an opportunity for us as providers to understand, what is the treatment should this happen? Are there people we should be making sure don't get this? Are there people who have pre-existing conditions that we should be worried about? And part of the reason we were able to resume is because we got that information. We were able to understand how we move forward. We were able to understand that this is not a risk that happens to even, a significant portion of people at all. And I want to make a distinction between, how significant the risk is for certain populations and how severe the outcome is. And so part of the reason why we paused is because the outcome was scary, it was severe. And there's a little bit of comfort that I take in knowing that as a system, we identified a severe risk and we looked into it, and then we decided what the next steps were.
Thank you. And again, to your point, Dr. Deborah, real-time research, you're looking at it right now and you're helping make decisions, you're walking us through it. And so one of the questions is from our panel, from our participants is, can you elaborate on this 89% of hospitalized patients that are unvaccinated? And what does that mean here in Genesee County?
So that's a national statistic. We can get the data for Genesee County. We do have data by zip code on who's getting vaccinated, and we can produce that. I do encourage folks, and my colleague Mary Catherine Crawford will be presenting a little bit later. We actually produce a weekly brief called the COVID Health Equity Brief through the Flint Center for Health Equity Solutions at Michigan State University. We do that in partnership with the health department. A lot of the various people on this panel help to chime in and make sure that we get the right information out to people. We can provide that. What the new sort of next direction for us, we have a really great COVID data dashboard. So you can go on gchd.us and you can see all of the data that we have on COVID cases and deaths. You can disaggregate that data or break it down by race, by gender, by municipality. And our health equity brief 2 weeks ago, we published the COVID cases data by municipality. We are gearing up to do the same thing for vaccination. So the short answer is we have the data available, and there's just a little bit of work to be able to provide that to the public in a format that people can interact with the way they interact with the dashboard, and even more importantly, so that it's actionable.
Mm-hmm. Thank you. Any addition to that, Dr. EJ or Dr. Wolford?
I did want to say one other quick thing about the clot is situation, because I get all my good medical stuff from Dr. EJ, and she's going to be practicing at McLaren and Flint. And so I might have to get me a new doctor, because I'm actually not happy with my primary care doctor. So I might be jumping ship and going to Dr. EJ. This issue around clots, I always try to help people put it in perspective, because they're talking about potential side effects from the vaccine. And I don't pretend if you were one of the 6 or 7, and some people have said, oh, it maybe is underreported. Let's say it was even 12. Okay, I don't know. Let's say the number was double. We're talking about something that's 1 or 2 in a million. The rates for blood clots among hospitalized patients is more in the order of 18 to 20%. So we're talking about 1 in 5, 1 in 6. hospitalized patients. So these are the people who are the sickest, are developing these blood clots as a function of getting COVID. I just want to put that in perspective for people, because when you compare those two things, you know, I think in our Dean Sousa made a really great statement. We did a session for a factory in Detroit, and he said that what the COVID virus binds to in your body, these ACE2 receptors and other things, is everywhere in your body, in your brain, in your heart, in your lungs, in your testes. It's everywhere. So if you get COVID, it's going to get in your system, and it's going to bind where it binds, it's going to go where it goes, and it's going to cause whatever damage it causes. When you compare that to the very small but now understood risk from the J&J vaccine, and we've got a pretty good profile of who might be at risk, and we now know how to identify, how to intervene early and all that, it's really no comparison. If you end up being one of those people, and we've all seen the pictures in India now, who's dealing with a massive surge of people just laid out in hospitals, really suffering, fighting for their lives. This is not the outcome that we want. We want prevention. The goal is to stop people from getting sick in the first place. And that public health prevention measures and the vaccine is without debate the best way for us to get there.
Thank you,
It's-
Dr. Wolford. Yes.
It's all about weighing that risk, right? It's all about weighing that risk. And we do that every day. When we get in a car and we drive, we know there's a risk that we could be hit by a semi and we could be gone. When we decide to walk outside and it's raining, we know we could get hit by lightning, but we go outside. We weigh risks every day. And here we are weighing the risk. And many people, when you take medications, pretty much everyone, all of us have heard, when you take a medication and it's advertised on television, you hear all of the different things it can cause, the bowel, this, the this, the. We then say, but we'll still take that medication. The same is true with this vaccine. And when you look at the risk, it is so very small. Many people take birth control, and they know that if they take birth control, there is a risk of a clot, a different kind of clot, but still a risk of a clot, and a much greater risk than with this. So now you just have to weigh it and say, as Dr. Deborah so nicely explained, that risk from this clot is so small, very severe, but so small compared to the risk of what COVID will do to us. And so we weigh that, and then hopefully we think to ourselves, yes, I should go and get vaccinated.
Thank you, Dr. Wolford. Dr. EJ, we're going to give you the last say as we close out our roundtable today.
Yeah, I think actually Dr. Wolford summed it up very appropriately, right? Everything is a risk benefit analysis. Everything is a weighing the risks. And from everything that we see, the risks of COVID are so much more severe and so much more just pertinent. And so you're doing that risk analysis for yourself. And I agree. I hope we fall on the side of erring to get vaccinated and preventing that risk of COVID infection. I want to second the idea of, social distancing, washing your hands, those preventative health measures, because they go a long way and they're also keeping us safe.
Thank you, Dr. EJ. I said that was close out, but here's Dr. Reynolds. He's got his hand up. All right, Doc, you're gonna close us out.
I'm sorry, I have to talk about smoking because we have many brothers and sisters who are smokers. Just because the risk is not proximal, in other words, it's not going to happen the next day, it's not going to happen the next week, it may take years, but some of us still smoke. And so that's a risk that is potentially deadly. So as my colleagues have said, we take risks every day. The question you must ask yourself, is it worth it?
Thank you, Dr. Reynolds. And as we prepare to go to our next segment today, Gary Jones is going to give us updates from the state. I do want to say, as we talked real time, this is research real time. All of us are involved in this huge experiment right now, this huge research. And basically what we're doing, we're asking questions with the goal of finding solutions. So if we all keep that in mind, do that for ourselves individually, ask these questions so that ultimately we can come to the solutions that will improve our overall health and being. health and well-being. And for the closing of the comments on the National Minority Health Month, we want to thank Mildred Hunter, who is our advocate at the regional level, for making sure that we get good information about this. So continue to look forward. Let's not let this be the end, but let's look forward to continue, ask questions, get answers, make informed decisions. Gary Jones, what's your updates for us from the state today?
Yep. Good afternoon, Yvonne. I got a couple here. So yesterday, Governor Whitmer set the state of Michigan on a pathway to return to normal by unveiling the My Vac to Normal plan as the state continues to push towards its goal of vaccinating 70% of Michiganders ages 16 years or older. To facilitate this goal, the Michigan Department of Health and Human Services will base future epidemic order actions on 4 vaccination-based milestones that, once achieved, will enable Michigan to take a step towards normalcy. In an effort to reach more Michiganders in need of COVID-19 testing and other public health services, the Michigan Department of Health and Human Services is partnering with Genesee Community Health Center to provide mobile COVID-19 testing, vaccines, and PPE, along with food, clothing, and other social services. The governor also recently received a second dose of the safe and effective Pfizer vaccine administered by Dr. Janae Caldoon. The governor joined 6 Grand Rapids teams serving as Protect Michigan Commission COVID-19 ambassadors and receiving their vaccines. The Protect Michigan Commission Youth Work Group is led by Flint's own Dondre Young. And lastly, Governor Whitmer announced Detroit Tigers great Miguel Cabrera has volunteered to serve as a co-chair of the Protect Michigan Commission and help promote the state's COVID-19 vaccination and education efforts. He and the Tigers have offered to produce public service announcements in English and Spanish that will encourage Michiganders to get vaccinated and continue to practice preventative measures such as properly wearing masks, social distancing, and frequent hand washing to reduce the spread of the virus until the vast majority of people have been vaccinated. And as a reminder, always michigan.gov/COVID vaccine and michigan.gov/coronavirus, still the best catch-all websites.
Thank you, Gary. Again, so much great information, and you've given us the website for the state. We appreciate you coming every Friday to give us those updates right fresh from the state. And again, thank you to our panel who gave us that wonderful information that led us to the part of the conversation we're going to have today. We talked about vaccines being available. Now we're going to look a little bit specifically at what's happening right here in Genesee County from the health department. Sherelle, I know you're out there, you've been out there working, doing these clinics. Give us the update from the health department, please. Sherelle Brown, you need to come off mute.
I'm so sorry. Can you all hear me?
Yes, we can now, thank you.
Okay, my computer said my connection was unstable. So as of Tuesday this week, Genesee County has administered overall almost 200,000 vaccine doses, and roughly 70,000 of those have been administered by the Genesee County Health Department. So we are making strides here. We have about 27.7% of Genesee County residents who are 16 and older currently fully vaccinated. So that's awesome. Next slide. Every day we're moving further and further away from less vaccines being administered. So we want to keep everyone getting their vaccines, and we want to keep everyone testing for COVID-19 in Genesee County. Recently, we just found out that we have all 5 of the COVID-19 variants in Genesee County. And as we all know, those variants do spread much more easier than the original COVID-19 strain. So we emphasize that testing is still very important. Getting those vaccinations are important as well. I've been at the clinics during this week and all of the weeks since vaccines have come out. And we have been seeing a decrease in people coming out to get their vaccine. So we want to make sure that you all know that the vaccine is safe, all of them, and come get your vaccine, get protected, and keep your family safe. In the last week, we've had 852 cases, which is a 43% decrease from the week before. And our 7-day positivity rate average has continued to decline. So last week it was about 17.9%. We're down to 15.7%, which means that testing numbers are dropping a bit. However, that's expected because our new cases are decreasing. So continue to get your vaccines. On the screen, we have some locations listed where you can get your vaccine. Currently, we have 2 drive-through clinics, Bishop and Flint Northwestern. Tomorrow, we will hold a drive-through clinic at Bishop Airport where we'll be giving the Pfizer vaccine. And that is a walk-in clinic, so you can come without an appointment. But going further, Bishop Airport will be the only site where an appointment is needed. So you can see on the screen that all of our other clinics have turned into a walk-in clinic. So if you can't get an appointment, that is fine. You can visit one of these sites, Flint Northwestern High School, Our Lady of Guadalupe Church, Central Church of the Nazarene, Shiloh Missionary Baptist Church, and coming soon, Mott Community College. And if you can only get to a clinic by appointment, you can still visit us at gchd.us or gc4me.com to schedule an appointment. Again, if you make an appointment, that will be at Bishop Airport. And then if you have a child who is 16 or older, you want to make sure that you're going to the clinic that offers Pfizer. Coming up May 2nd at Bishop Airport from 2 to 5, we will be offering Pfizer and also Johnson & Johnson, which was reintroduced back into the community on yesterday. And we'll also offer Pfizer and Johnson & Johnson. Oh, I'm sorry. Tomorrow we'll be at Northwestern, not Bishop, but we'll still be offering Pfizer and Johnson & Johnson. It'll be a walk-in clinic from 9 to 1 p.m. And then May 5th from 9 a.m. to 2 p.m., we're going to be offering Pfizer only. So get to the clinics. And if you have received your first dose from somewhere other than the health department, we are currently accepting you all to come get your second dose through Genesee County Health Department. Before we were not doing that, but now we are accepting those who have received their vaccine from another entity the first round.
Thank you so much, Sherelle. And I really want to appreciate and applaud the work that the health department is doing. At one point, as we all know, we had very difficult time getting vaccines. Now everyone who is eligible can get a vaccine, and these multiple sites are available. So we really want to encourage the use of them. So thank you, Sherelle, for that. One of the questions that we had last week that we weren't able to answer is we talked about the vaccines and vaccine treatment. We do recognize that there are people who didn't get the vaccine that are still getting COVID, and there are some who may have had the vaccine not getting COVID as bad, but there are some treatments. And Dr. Woolford's going to give us an update on some of the other treatments from that are available for us should we have been diagnosed with COVID. Dr.
Thank
Wolford.
you. Thank you so much, Yvonne. So last week, we talked a bit about monoclonal antibodies, right? So that if your body hasn't created antibodies itself yet, that you could be given these antibodies that are made in a lab to help you fight off the infection. And that's something that could be done early on in the course of the illness within the first 10 days. But then the question came up about Remdesivir. And so this is an antiviral. This is a drug that fights viruses. And I wanted to mention a little bit about it so that you would know about this option for treatment. There have been studies that have sort of had mixed findings about it, but it seems that maybe it can be helpful. And so the way it works is, if you imagine that this bowl is our cell, once the virus gets into our cells, remember I've said before that what it wants to do is to make copies of itself. It just wants to replicate and replicate, making copies of itself. And so the way it does that is by using the ingredients that are already in our cells and taking those ingredients to make itself. So like in this particular recipe, we have almonds and cherries. So it would take the almonds and the cherries and it would use those to make itself. Well, what the antiviral does is it sort of floods our cells with other kinds of nuts, not almonds. So when the virus goes in there, tries to get an almond, instead it gets a pecan because that's what's there. There's so much of it there. And tries to replicate itself with the pecan, but it just doesn't work with pecans. It doesn't work with this. It only works with what was originally in our cells, i.e. the almonds. And so now it keeps reaching in, keeps only getting pecans, and therefore cannot replicate. And so it can't do as much damage to our bodies. We're able to fight it off because we have this extra help from the antiviral that stops the virus from making copies of itself. And so therefore we can fight it off and we can do better. The thing about remdesivir is that it is an IV. You have to get it by an IV. So you give it to hospitalized patients. And hopefully there's going to be more work done. And I know actually there is being more work done at the moment to see if there can be an antiviral that can be made that is an oral, like a pill, that can be taken earlier in the course and taken as an outpatient. So that is one form of treatment that we could think of. There is one other one, and I was thinking about whether to talk about this one today or do it another week, but I think we'll do it today. Many of you may have heard about the use of steroids. And this is a very interesting question. Should you get steroids? And the answer is yes and no, depending on when we're talking about. So what steroids do is, if you remember, when you get sick, your body, it's like the immune system is sort of like a fire. It's sort of like a flame, right? You want it to light, you want it to work, and then you want it to go out. You don't want it to burn out of control, right? You want it to just be doing its job of fighting off the infection long enough so that it can actually fight the infection, but not go out of control. Sometimes when we have an infection and we have our body working away at this, sometimes it doesn't stay under control well enough. Sometimes our body the immune system gets to work so much that it doesn't just fight off our infection, it actually starts damaging our bodies because it's sort of gone out of control. And that's the autoimmune sort of thing, where it's just the flame is like too much. We don't need all of that. That is just way, way more than is needed. And so what the steroids do is it puts the fire out. I was going to douse it with water, but I think I will get wet. So just to say that what the steroids do is stop it from going out too much, which is what happens in the second phase of coronavirus. The second phase of coronavirus, the antibodies, or the later phases, the antibodies or the immune system is doing too much. It's too much flame. It's burning for too long. It's damaging our organs. And instead of letting that happen, if you give steroids at the end in the later stages, it will help to dampen down that fire and help it to just do what it's supposed to do, not burn out of control. That's why you don't want to give it in the beginning, though. If you give it in the beginning, it stops it from burning as we want it to burn. But if you give it in the end, it stops it from doing the excessive damage to our organs.
Thank you, Dr. Wilford. Always amazing example. So now I'll look at my candle a little bit differently and think about what I need to do to improve it. So these are things too, just quickly, that they can ask their doctors for as we switch to the next segment and look at our health equity brief. These are conversations that we can begin to have with our physicians. One of the other things that we really want to emphasize is you hopefully now have information that will help you make some good decisions and ask some good questions. So we want to look at our equity brief now, because this gives us some additional information to help us think through the risk and benefits and understanding the overall impact that these things are having in our community. Dr. Deborah Holden, help us really unravel some of these new data that have come forward.
Okay, great. And after Dr. Wolford's presentation, I just want some roasted nuts. I want to be at her house post demo, because all these nuts and fruits are great for learning, but I want to know what happens to them after the demo. So next time, Dr. Wolford, next time. We are, and I'm gonna be cautiously optimistic. Case counts declined in Genesee County since last week. The key factor here is to keep testing high, keep testing constant. That is our best way of knowing, are the changes that we're seeing real, or are they kind of spurious, or a function of we're just not doing as good a job of getting case identified. It looks like we are still, people are still utilizing testing. So this looks to be a legitimate decrease. The testing positivity rate declined. It's still pretty high. So this is of the people who are getting COVID tested. We had sort of capped out at just around 21%. It's down to, last week it was just under 18%. This week it's at 15.7%. So that's somewhat good news. It means that other people who are getting tested, fewer of them are testing positive. But again, the goal, people got to keep getting tested. We have to keep honoring the protocols, and we need to get to that sweet spot and hit the target goal of 70% vaccinated. We have an ongoing problem with missing race data. We did a lot of work early in the pandemic to try to turn the tides and narrow that disparities gap. And unfortunately, we're losing our ability to speak with certainty how we're doing on that. If you notice here, the bright reds are the unknowns. In Genesee County, we 61.7% of the case data from last week have unknown race. And in Flint, that's 58.5%. We showed you it showed you this a little bit differently last week to demonstrate that a lot of the missing race data seems to be coming from communities that are majority white. That's not all of it. We're trying to figure out what that is. Right now, the big lift of trying to backfill that data had fallen on the shoulders of the health department. And unfortunately, we have the human resources we have. So their main efforts obviously are focused on continuing this great testing and also getting the shots in the arms for people who want it. So we're trying to figure this out. And I just encourage individuals, fill out this data when you get it. It's important that we know who is impacted, the extent to which they're impacted, so we can make sure that we're serving all of our citizens fairly and equally. Next slide. Oh, she went too. Okay, great. This is just a little recap for you, your Public Health 101. Our goal is to get to herd immunity. You've seen the governor has a reopening plan. That phased reopening plan is linked to percentage of the population that's vaccinated. Our main goal is to get enough people vaccinated. You see at the front there, you've got that one person in the front who's infected, but that person is surrounded by sufficiently enough people who are immunized. The likelihood that he spreads it to somebody else gets very, very low. Even the unimmunized people get protection when they're surrounded by a lot of people who are immunized. We do know that racial ethnic minorities have been hit harder by COVID. So there's also will be an equity issue attached to that if we don't do a really good job of getting those shots in the arms of everybody. I'll stop there because we got to talk about Mental Health Month, and Mary Catherine's going to bring the press on what our policymakers need to be doing.
Yeah, so thanks, Doc. So as always, if you guys have any questions, please shoot me an email at crawf457@msu.edu. If you have any questions about the data that Dr. Zab just walked us through, contact Rick Sadler at SADLERR at msu.edu. And don't forget to subscribe. So let's just kick off with our recommendations for policymakers. I want to talk first about genomic surveillance. Dr. Reynolds spoke earlier about the dangers of variants popping up. And I just want to echo that and add that right now only a sample of COVID positive tests are genomically sequenced. And what this means is that their genetic material is examined to identify mutations and determine the variant strain type. So as more and dangerous and contagious variants appear, we really need to be prioritizing this kind of surveillance in real time to track how coronavirus is evolving in our community and in the state of Michigan. And this is so important to help scientists in our research and to understand how the virus is mutating, and therefore how vaccines and our other mitigation strategies are working so that we can tailor measures as we need to prevent infection as additional strains appear. So this couldn't be more critical as we're finally seeing signs of getting this latest surge under control in Michigan, and we want to maintain that progress. So we can build capacity by doing this kind of surveillance, by allocating more funding, investing in these technologies for more sequencing of positive samples. And the next thing I want to address is the American Families Plan Act. So this is another extension of COVID relief efforts by the Biden administration to ensure a more equitable recovery from the pandemic. And this plan really speaks to equity and that it rewards the work of the people rather than the wealth of the people. And it does this by cementing essential tax credits that will help families and also funnels significant investments into childcare, pre-K education, and also community college programs. And I just want to point out that the success of these educational programs are really going to be dependent on coordination between our state and federal government. And so when this law passes, we want policymakers to be prepared and be prepared for implementation down the road ahead so that this is done so justly. And last but not least, our mandate equity piece for the day. So I'm going to continue talking about the economic recovery. We've talked about different ways that policymakers can bake equity into pandemic recovery effort, and why this is so important, because economic hardships are faced by our Black and Brown populations more so than their counterparts. And this is not new. We saw discriminative distribution of Paycheck Protection Program funding, and we see this in wage gaps in general. So we can rebalance this scale with better fiscal monetary policy, and that works for everyone. And we can do this by removing economic or barriers to economic gains for minority populations by establishing more supportive business networks or ecosystems with policies that really produce equitable outcomes. So this looks like equal access to capital. So I'm talking about money from banks, investors, public programs, foundations. Also better knowledge sharing for new and struggling business, right? Knowledge from the private and social sectors can be leveraged to build up minority businesses. And lastly, there's always room at the table for those who want a seat. And through policy, we can actually increase the number of opportunities for mentorship and sponsorships. So those are my thoughts for policymakers this week. So let's quickly talk about what our community, what we can do as a community. So I mentioned last week that if you see businesses violating public health and safety protocols, you can use the reporting forms on michigan.gov or call the MDHHS COVID hotline at 1-888-535-6136. And if you call this number, they can not only help you find the form that you need, but even connect you with a translator if that is what you're needing. You can get your exposure notifications or potential risk of exposure by downloading and using the free My COVID Alert app. And then I just want to talk about the basic things people can do. Offer to sign people up for clinics, share links, safely, offer rides to people who can't get to drive-throughs themselves. So, and as always, go to gchd.us/COVID-19 volunteer.
Thank you so much, Mary Catherine. A lot of good information, and it's there for us. These things show us that our voice counts and our vote counts, even though it may seem a little bit challenging. So hopefully you'll take this information. Let's pay attention when these mandates come out, when these bills are passed. Let's make sure we hold our officials accountable. One of the things we want to talk about next as we move forward is May is a Mental Health Awareness Month. Mental Health Awareness Month. I want to invite Katie Baxter to come and share with us a little bit. We have a special millage coming up for our mental health programs here, Genesee Health System. So Katie, can you come and share with us a little bit about what's going on with the millage?
Sure, definitely. Thank you, Yvonne. Next week, we'll talk a little bit about mental health awareness in general and how important it is to take care of our mental health as well as our physical health. Today, I just wanted to mention the millage and encourage people to vote for the millage next Tuesday on May 4th. And the reason is because Genesee Health System is the mental health safety net for our county and our community. And mostly we are Medicaid funded and we apply for and achieve grants to support some of the other functions that we provide, but there really is limited funding unless it's Medicaid, and not everybody has Medicaid, and not everybody meets the criteria for some of the severity of illness and some of the Medicaid requirements that we have to fall under. So we really encourage people to support the millage, as we know that 1 in 5 people experience a mental health challenge in their lifetime. So it's not just a small group of people, but many of us at some point need some kind of supports or help. And it's certainly been evident during the pandemic. So I want to let you know that the millage is $9.5 million it will bring to our county over the course of 10 years. And it really helps to support 7 focus areas. A lot of it's related to law enforcement, a crisis intervention team. So when somebody's having a mental health challenge that the law enforcement officers come across, that they can access behavioral health supports immediately through iPads and other means. There's also law enforcement through the courts and corrections and jail diversion programs. There's also funding for suicide and crisis prevention services, as well as schools prevention and crisis de-escalation in schools, and to develop a crisis center. We have a virtual behavioral health urgent crisis center now, but it is virtual through grant funding, and we like that to be sustainable so that we have a brick and mortar place for everyone who's having a mental health crisis to be able to go and not have to wait in long lines in the emergency rooms. There's also funding, it will provide funding for health and wellness for vulnerable populations in terms of housing, transportation, and nutrition, a lot of the things that we call social determinants of health. So we really encourage everyone to get out and to vote. Some people have absentee votes, but to vote on May 4th and vote yes for the millage, because this will bring a lot of support and dollars for our county and community to give people the behavioral health supports that they need and have sustainability. So thank you so much, and we encourage everyone to get out and vote.
Thank you, Katie. Now that is Tuesday. May 4th is Tuesday, so just a couple days away. And we want to just remind you again, your voice matters. Your vote in this case is your voice. So we would encourage you, if we don't make a difference in our community, who else will? So we're appealing to you. Make an informed decision. Look at what's available, and let's make that informed decision on Tuesday. Now, Afton Shavers, Afton, I appreciate your flexibility, and that's one of the things that we talk about all the time as our partners are here on the call with us. So we, on the webinar with us, we want our participants to continue. We've got a few more minutes, put those questions in the queue. Afton has a tremendous amount of information for us, and time won't permit us to share it all, but Afton, I want you to come on and chat with me for a minute about recast and just frame it out for us. And next week, we'll have you do this wonderful presentation on all of the things that are available for us for during Mental Health Month. So can you frame this Mental Health Month and what is recast going to be offering?
Absolutely, Yvonne. So as we alluded to, the entire month of May is dedicated to Mental Health Awareness Month. And part of RECAST, which is Resiliency in Communities After Stress and Trauma, is focused on mental health. And so we sort of put together a month of activities that we'll be sharing out. If you can actually go to the next slide really quick here. We have a few things that will be planned throughout the course of the month. So as you can see, we've got some different themes that we'll be talking about, and really we're trying to raise awareness about mental health and reduce the stigma around mental health. And so we're focusing on the fact that talking about mental health and being open to having communication about different topics in the area of mental health will help people feel more comfortable and more confident in seeking help in managing their mental health, and also being preventative, right, and managing their mental health. And so health of any kind, mental or otherwise, is wellness. And so we really want to sort of reduce some stigma around folks looking for ways to take care of their mental health. And doing that, we'll have a couple activities that we'll be hosting. Everything kicks off starting tomorrow, because tomorrow is the first day of the month of May. So we have a really cool overview video that will be posted tomorrow on all of our social media. So you can check that out to find out what's all coming. We have a really great opportunity on Sunday to do mindfulness and yoga with our friends from the Crim Fitness Foundation. So that information is already posted, and anybody who wants to join that yoga and meditation session on Sunday for free can absolutely do so. It's going to be hosted on the Zoom live so that people can participate. And there's a Facebook event that was created for that as well. So once again, you can find it on the RECAST Facebook or on our Crim Fitness Partners Facebook as well. So that's happening on this Sunday. So please feel free to take advantage of that. We'll additionally this week have, or this week coming, I should say, we have a Don't Not Be Sad or Do Not Be Sad activity that's scheduled for our Mindful Monday. It's a really cute activity that people can take part in, and also get the recipe for healthy donuts. If we were not in a virtual space, I would absolutely be running around town giving people donuts. But because we have to be virtual and we have to be mindful of COVID protocols, we've sort of adapted it so there's a way that people can participate online. And then on Tuesday coming up, we have a Talk About It Tuesday. So we'll be having a conversation with some of our partners from Genesee Health System, and we'll be talking about really the notion of being mindful and being aware of our stress, and also how that relates to anxiety and depression. So we got a lot jam-packed. There's literally something every single day. There's opportunities for training that will be free and available via Genesee Health System as well. And we'll kind of keep you updated as we move through the month of activities that you all can participate in. As you see on the screen, we've got a mental health Jeopardy that'll be happening. We've got a mindful jars activity that we'll be doing with some kids. We've got a Grow Positive Thoughts activity that will be happening with our seniors. And we're hosting a special feature at the drive-in that will be limited, unfortunately, to 75 cars, but we definitely want to invite family to come out and join us at the drive-in movie.
Afton, you are really going to have to tell me about how this is a healthy donut. I'm going to be really interested in looking at that. There's
absolutely.
There's so many wonderful activities that are being planned, and you're partnering with a number of organizations across the community. So we're going to have you come back next week, and we'll talk more in detail about this, because it is a month-long events. Every day, there's going to be something happening during the month of May to give us a focus on mental health. And I was sharing even last night as we prepare to close the day, that sometimes we're not mindful of our own health and well-being because we're so busy. And all of you that are on this webinar, you're helpers, you're navigators, you're social workers, you're community health workers, and you're out there every day trying to make it better for somebody else. This month, let's focus in on how to be sure that we're okay so we can help others be okay. One way you can do that, community health workers, is get these community education units so you don't have to worry about if you're going to have your certifications in line. So please fill out the paperwork for the continuing education units that are available for you through Mishwa. We also want to encourage our social workers. The work has been done to put this in place for you based upon the request from social workers. Get these continuing education units for social workers. Please complete the information, the post-webinar survey, and send that information in so you can get your evaluation and your certificate directly from Michigan State University. We certainly appreciate that partnership. We want to thank you for joining us today. And we're going to ask you to like us on Facebook, right? Like us on Facebook, subscribe to our YouTube channel, Healthy Flint. Email us for any questions that you might have at info@hfrcc.org. We want you also to give us a call anytime you need a question answered. Call 810-835-2130. Mindfulness, we may not answer if it's 12 o'clock at night, but if you put it there, we'll pick it up the next day. We want to thank you for joining our webinar today. It would not be what it is without you. So on behalf of the Healthy Flint Research Coordinating Center and all of our partners, we appreciate you for joining us today, and say, please join us next week.